My name is Dr. Daniel Kaminski. I am a urologist at the Urology Clinic Wienerplatz in Munich. Many foreign patients come to us for checkups. Many patients with urological cancer also come to us for qualified medical care after diagnosis in their native country or in our clinic. Unfortunately, patients are often misdiagnosed in their native countries. In my opinion, this is one of the main reasons why so many patients from abroad come to us. People hear from others about numerous cases of misdiagnosis by doctors in their native country, so they don't always trust specialists in their homeland. This is probably one of the main reasons why patients choose Germany. Many patients from the former CIS countries, mainly from Russia, come to our clinic. Of course, due to the hostilities, the number of patients has decreased, but we still have many patients from the former CIS countries. We also have many patients from the United Arab Emirates, Qatar, Saudi Arabia, Oman and other Arab countries. Patients come to Germany for treatment because they are confident that German medicine is of the highest quality. Germany offers the services of highly qualified and respected physicians with extensive professional training. This contributes to first-class diagnosis and treatment. In addition, German medicine is characterized by high-quality patient care because German hospitals employ well-trained nursing staff to work with patients, which is well known to foreign patients. When patients come to Germany for treatment, they receive comprehensive medical services. The doctor's first task is to make an accurate diagnosis, after which a treatment plan is developed. Ideally, the patient comes to Germany, undergoes a diagnostic examination, is treated without complications, and returns home. This is the essence of the concept of medical care in Germany. Many foreign patients already know about the negative experiences of treatment in their native country from their relatives or friends. They do not want to repeat the mistakes of their relatives and prefer to be treated abroad. Patients who can afford it travel long distances to Germany for treatment and sometimes to Switzerland or other European countries. But Germany is by far the main destination for medical tourism. The most important advantage of German medicine is that the work of medical laboratories where biological material is tested, and private practices, large hospitals and rehabilitation centers is a single well-structured system. This system is so well thought out and perfect that all its elements fit together perfectly and work excellently. A few years ago we heard many requests to open a clinic in Russia, and now our patients in Dubai are expressing the same desire. While the clinics in Dubai are indeed excellent and have established workflows, many elements of the country's medical system do not work or interact properly. Because some elements of the country's healthcare system simply do not work, patients are not always able to receive quality diagnosis or treatment. This is not the case in Germany because every part of the healthcare system works very clearly, efficiently, quickly and reliably. If you are interested in an analogy with Europe, I must admit that in some European countries, for example, the laboratory diagnostic segment does not work. How can a doctor diagnose or treat a patient in such a case? It is simply impossible.
What genitourinary symptoms or complaints should alert the patient to seek medical help?
The answer to this question depends on the specific field of urology. Obviously, if the patient has burning when urinating, blood in the urine or unexplained pain in the right or left side, an examination is necessary to make an accurate diagnosis. However, some urological diseases may not cause symptoms until a certain point, particularly kidney and bladder malignancies, prostate cancer and testicular cancer. When a malignant testicular tumor reaches a large size, it can be detected by palpation. The neoplasm has a dense consistency and is easily palpable. As for prostate cancer, it cannot be detected by palpation and the patient has no complaints with this oncopathology. Therefore, men over the age of 40 to 45 years should be annually screened, since it is impossible to detect the development of this type of cancer due to the lack of symptoms.
Are there any types of prostate cancer that develop before the age of 45?
Yes, there are. However, it should be noted that the risk of developing prostate cancer at the age of 40 to 45 is quite low. Nevertheless, men at this age are also at risk of developing oncopathology and sometimes aggressive prostate tumors. In general, the risk of developing prostate cancer increases after the age of 45.
Could you please tell us about the new diagnostic and therapeutic procedures used in your clinic?
We always use the most advanced diagnostic methods from laboratory blood tests to urodynamic studies and ultrasound scans. Every few years we introduce the latest standards in ultrasound diagnostics, such as 3D sonography, elastography and tools for assessing tissue density and temperature. Microfocus ultrasound is expected to develop rapidly over the next few years. It offers the same high-precision imaging as MRI. This method is characterized by high accuracy and reliability and is of course available in our clinic. Another new method is an MRI-guided prostate fusion biopsy, which is a combination of ultrasound and MRI scans. This diagnostic procedure allows prostate cancer to be detected at an early stage. This examination is also performed in our clinic. We also perform cystoscopy, including video cystoscopy and flexible cystoscopy. All of these diagnostic procedures are painless and performed on an outpatient basis. Cystoscopy allows us to examine the bladder from the inside and make high-resolution images of the inside of the bladder. We always follow the latest medical standards.
If a patient has already been diagnosed with cancer, why is it important not to waste time and to start treatment as early as possible?
It all depends on which cancer is diagnosed. For example, a malignant prostate tumor is usually characterized by slower growth than bladder or kidney tumors. Therefore, if a patient is diagnosed with prostate cancer, treatment may be delayed for 2 to 3 months. In cases of bladder or kidney cancer, treatment should be started immediately. Treatment for these types of cancer should be started as soon as possible because of the risk of rapid tumor growth and spread of the cancer process. Therefore, the decision to start treatment is always made on a case-by-case basis. In general, when a patient is diagnosed with cancer, it is not worth delaying the start of treatment.
What would you recommend to patients from abroad who are considering traveling to Germany for diagnosis or treatment? What advice would you give to them?
If there is no competent specialist in the patient's native country, I advise patients to look at the cost of treatment abroad and then seek medical help from the specialists with the best qualifications in the medical field of interest. It is also important that the patient can allocate enough time for the upcoming treatment abroad, because it is impossible to come here and expect to return home the next day. This nuance should also be taken into account. I am convinced that if a patient has a specific problem in a specific area of medicine, they will receive high-quality medical care in Germany.
Many patients come to you from abroad, and you have probably had cases where a patient has been misdiagnosed. Maybe the doctors missed the cancer, or vice versa. Am I right?
Yes, you are right. In our clinical practice, we have repeatedly had patients who were diagnosed with cancer in their native country and who came to us with a scheduled surgery just to get a second opinion. We, on the other hand, have determined the absence of a malignant tumor based on their diagnostic results. There are also situations where a patient is diagnosed with a benign neoplasm in their native country, but unfortunately we diagnose a malignancy. This happens regularly, and this fact is one of the main reasons why patients decide to travel to Germany for treatment. Patients are willing to spend money on their trip to Germany because they know that here they will receive an accurate diagnosis and effective treatment.